So my name is Dr. Thomas Rausch in West Palm Beach, Florida. In the case that we're presenting today, this patient had severe amounts of pain into his left thigh, which was manifesting as a disc pinching a nerve, compressing a nerve going down to the thigh. So that's something I see every day that I see patients in clinic, and certainly I always try to do very simple steps first, things like basic types of therapy and non-surgical treatment. And usually that's successful, but when it's not successful and MRI scan is showing an area of compression and that compression is consistent with the patient's symptoms, then we have other options. And traditionally those options would be much more invasive, would involve bigger cuts. I mean, even a minimally invasive microdiscectomy type surgery, which is a more traditional surgery, sometimes involves multi-inch incisions and a lot of pain afterwards and a lot of recovery. Where I make a smaller incision and can split through muscles and not really damage any muscles, not create much scar tissue, that's a significant improvement. If I were a patient, that would absolutely be the way I would want to be treated, just so I can recover my normal activities much more quickly and without near the complication rate that can occur when nerves are being manipulated through more formal or open spinal surgery.
Hello, my name is Michael Lewandowski. I had an accident. It was a side impact, driver's side, direct hit, dislocated or gave me herniations and within my disc and so forth. I was having a lot of discomfort within my legs, my lower back and everything else. So with the discussion with Dr. Rausch, we proceeded to go ahead into the surgery aspect of it. Again, I'm very comfortable with him, and that's why I agreed to it, to go through the surgery, to where I can go ahead and go back to work.
This is a visualization tool and also a dissector tool. When I place that inside of the patient in this direction, what this will allow me to do is dissect through tissue. So it's a little kind of a bird beak mouth, and when I press this button, it opens. And that allows me to advance, open, and dissect through tissue to advance down to the location that I want to be. And it does that and also allows me a working channel that I can remove material through this cannula. So this is another device from the SpineView system that allows an element of safety because I'm coming down laterally or from the outside, and this allows me to get down to the disc and remove bone the way that I want to, as well as look directly through here with a camera while I'm evaluating the osteotomy that I'm going to perform of the superior articular process.
It's now 3 months later, after the surgery. My pain and everything that I had within the leg and everything else, it seems to be improving. It's no longer constant. Before the operation, I was taking the pain medication, much more constantly. After the procedure, I continued with the medication, and as the healing process began, I began to take less and less. With Dr. Rausch and everything else, he's done a fabulous job. I have the confidence within him. I'm optimistic that everything's going to be beautiful.